Hi everybody. It's been really fun watching these videos. It's been a couple weeks since I looked back at them, honestly, but the ones that I did watch, I enjoyed seeing. I like that we're all in such diverse places and we have so many different cases to look at. So I am following up on my patient who has Meniere's disease in this video. I got questions from Dr. Westrick, Jess, and Meg, and I'll be answering them right now. If I can get this to work. There we go. So the first question was the second program that I made for the hearing aids based on the original audiogram when his Meniere's was active? And then how did I decide what to use as far as gain? And I created the second program with the original audio in mind. However, I just roughly estimated and gave him a low frequency boost based on that audiogram. I don't have a picture in here, but basically right now his hearing loss is mild, sloping to moderately severe in his right ear. His left ear is normal. And previously it was moderately severe, rising to normal, and then sloping back down again. So I just gave him a boost in the lows. I only did this in case he had issues before he came back for his first follow-up. The next question was, did I fit the hearing aid to real ear or target in the test box? And so he has two programs. The first one is his universal program. The second one is the one that I put in case the Meniere's begins to onset again. So in his universal program, he is fit with real ear measures for his current loss. However, in the second program, I did not fit. That was because we have an hour for our fitting appointment. He's a first-time user, so we had to do real ear, make the gain adjustments, teach him how to insert and remove it. We go over paperwork, cleaning. I'm sure people who work with hearing aids right now know how long that can take. He did only have one hearing aid as opposed to two, but it still adds some time on. So that's something that we're going to address at his next follow-up. Jess asked if there is a specific reason for choosing to fit him in a Phonak, and my short answer is not really. My clinic mainly fits Phonak Insignia for RICS, and then we've been using Starkey for customs because of the rechargeability. We rarely fit Widex and Oticon, and even less so fit Unitron and ReSound, so those are kind of not popping into my mind unless there's a really specific reason why I'd go for them. At the time of fitting him or ordering the device, Phonak was our number one choice, so it was kind of our go-to. Most patients report satisfaction with Phonak's hearing aids, especially the RICS, and with unilateral fits. I've done a couple and I've had good luck with patients being pretty happy with them, so it was kind of a no-brainer. Phonak is no longer our first choice, in my opinion, or at least with my clinic. They've been having some issues with repairs. The charging cases need repair quite a bit. They're having some shipping issues. So it's not the first choice, but I think for someone with a unilateral loss, I would still stick with Phonak, just based on previous results. Jess also asked if this patient has been counseled on burnout as far as his Meniere's. This is not something I discussed with him personally. I haven't had a vestibular rotation. I haven't really worked with patients who have Meniere's other than this one. So this is the first one that I saw roughly from the beginning and then followed up with hearing aids. I didn't do his audiograms, which is when, if we discuss the case with the physician, that's the time we would do it. And I just wasn't there for those. Somebody else performed them. At our consult or hearing aid evaluation, it was hearing aid focused. Yes, we talked about Meniere's, but it was more so, what hearing aid do you want? What can we do for you? And then his first follow-up was for questions that he had after the first couple weeks. So it's not something I've addressed yet. The ENT who is seeing him and diagnosed him and recommended testing has rapport with the vestibular clinicians that tested him as far as what to expect with outcomes. That's something that I'm sure he plans on discussing with him. I haven't really dug into the notes to see if he did. This physician tends to have pretty sparse notes. He sees quite a few patients, so I couldn't really get much out of him unless I asked him one-on-one, and it's hard to catch these physicians at a busy ENT clinic, so I'm not really sure. Next question was, does my clinic perform aided audiograms to assess hearing aid benefit? And we do, but only if the patient requests it. So sometimes patients come in and they don't think that the hearing aid is doing anything, or they don't think that their hearing is any better with it as compared to before. And they say, do a test on me. So we'll put them in the booth. I always counsel that the results are not extremely accurate, but they can show an improvement, or they show that hearing is definitely better with the hearing aids than without them, even if they don't feel like it. So it's a good visual for them. However, this patient is not concerned about that. He already came in at his first follow-up and said he's very happy with the hearing aids and he perceives benefit. So it's not something that I would choose to take time out of the appointment to do if he's not really complaining about it. I would, however, tend to use a questionnaire if he came in with concerns. For this one, for this patient, I thought about the AFAB. We did not do any questionnaires in the beginning. That's actually something that I'm working on. Talking with my preceptors and integrating into our hearing aid evaluations is having patients fill out a questionnaire either when they come in or before they come in. But for him, I think doing the second part is good for him to compare the differences and how he feels like he's hearing with and without his hearing aid. And then I'm pretty sure this is one of the last questions. I was asked if we have follow-up procedures, what they are, and do we plan to do yearly audiograms. So this patient is already scheduled for annual audios or sooner if he needs them. So if he feels like he's had a change in hearing or things aren't sounding quite right, we'll get him in sooner. He's already set up to follow up every 6 months with the physician just to make sure everything's going okay, and also every 6 months for hearing aids. Because he's a new user, we like to see patients at about 3 weeks to a month, then 3 months, and then we go on to routine 6 months. So he'll come in again one more time before he gets on a more regular schedule. And that's the appointment that I plan to either use real ear or put his hearing aid in the test box and to actually have a better program for him in his second program than just my estimate. Overall, though, he's doing really well. He's very happy with his hearing aid. It's been cool to follow through with this, and I'm excited to see how it goes in the future. I believe that's everything. So I just wanted to say thanks again for the questions. I hope everybody is having a good time at their current rotation, and I'm excited to hear about all of the other videos.